Well, in the last 2 weeks, law enforcement has responded to 3 major incidents involving a suspect with mental illness. Today, community leaders met to address the challenges they face in treating and providing care to the mentally ill. Congresswoman Martha McSally held the roundtable discussion focused on specific challenges that she can take to the federal level. She heard from several community leaders about what they deal with on a daily basis. Here's 9 News Side's Ricky Mitchell with the story.
4 days ago, a man locked himself in his apartment, firing gunshots and making threats. The Tucson Police Department Mental Health Unit responded along with negotiators.
You're an intelligent person. Your entire family respects you. Your entire family loves you.
But when the man walked outside and fired shots at officers, an officer returned fire and killed him.
Would really prefer to not have law enforcement be the first encounter with somebody who's dealing with mental illness.
Congresswoman Martha McSally recently introduced a bill called the Mental Health and Safe Communities Act. That includes a list of specific mental health challenges. For example, access to care facilities and alternatives to jail.
What's happening is some people who are mentally ill are finding themselves behind bars and they get a bed there when they really need a bed in a facility that's actually going to help them treat their illness.
Her bill also includes the expansion of crisis intervention teams like the ones at the Pima County Sheriff's Department and Tucson Police.
We feel like we're delivering a very good level of service for those that are in acute mental health crisis. What we're looking for now, and we hope that our bill will provide, will be that step down level of care. So those folks who still need some sort of structured care provided for them to help keep them in recovery, but not necessarily, let's say, in a lockdown facility like the crisis center.
And Congresswoman McSally said a repeated theme in today's discussion was the stigma surrounding mental health. She said people need to start treating mental illness like any other disease so that more people are willing to seek treatment without feeling embarrassed. Guy?